Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Before we begin our waxing exercise on number 30, there is a procedure which I recommend you do with your visitant before every project. And it's important to realize that this should be done before the project and never during a project. So what we need to do is zero this piece of equipment. And the way to do this, number one, is to turn it over and very quickly take your little screwdriver and be sure that all the screws holding the teeth are snug. This prevents the teeth from moving and shifting slightly. You can see this one was quite loose. And you'd be surprised how quickly they loosen up with use of the visitant. And by tightening them down, you prevent them from getting out of alignment. I've already done the upper. One thing, you don't need to have a screw for your preparation on number 30 because we want to be able to remove that during the project while we work. Now, once we have the teeth firmly set into each upper and lower member, you have to go to the back and loosen the 4 screws. Two upper and 2 lower. And this will allow you to now move these a little bit. And the idea here is to squeeze them a little bit and hold them firmly in place, get maximum interdigitation of the teeth, and then very slowly tighten these 4 screws back up. Don't tighten one all the way to completion and leaving the others loose. It's very important that you slowly snug them and go around and bring them all to complete tightness together. Okay, the visitant is now ready to go, and we can feel reasonably secure that things are not going to be moving around, and you'll have the maximum interdigitation of teeth so that you'll have the easiest time possible getting the occlusion correctly waxed. For this waxing, we'll be using the Whip Mix green regular casting wax, which you have in your kits. And we want you to realize that number 30, in this exercise, we will be using the actual visitant prepared tooth and not a die to do the project. Whenever we begin a waxing, you should always lubricate the die so that you will be able to remove the pattern later. And you don't need a lot of lubricant. Get all the surfaces moist. And then you can even dab it dry to remove the excess. Okay, we're now ready to begin our first additions of the wax. For this step, use the small end of your number 7 spatula and begin by just putting a thin layer of wax on the entire surface. This allows you to visualize correct adaptation, get your margins established, and gives you something to start with for subsequent additions of wax. So you can see that these are very thin applications so that you can visualize that you have wax on the entire surface. Don't flow a lot beyond the margins, and that's ready to go now. The next step is the bulk addition of enough wax so that you can remove this pattern and check the internal adaptation before spending a lot of time working on occlusion. Again, keep your margins in mind. As you work. You need to do this circumferentially and on the occlusal surface. We're going to cut away for a moment and finish this part off camera. We have enough wax now that we can feel confident handling this pattern without breaking it. We can check the internal adaptation and work from this point in completing the pattern. What we need to do now is very gently lift the pattern, tease it off the tooth, and then you can check the internal aspects to be sure that you have adequately registered the necessary details. And that looks pretty good right now. So we'll replace it onto the die. And certainly we'll have plenty of opportunity to correct for the margins later, but if you get them close now, that's that much less work you'll have to do during the final finishing stages. So you can begin to carve and work this to an adequate margin, and you can check it by very gently teasing your pattern off and looking at the margin and putting your pattern down and seeing that it just covers that prepared margin. At this point, we also need to make sure that our relationship is in the right place. So we need to place this back into the Visiodont, and at this point, look to make sure that you still have proximal contacts that are open and that the occlusion is not high already, that we have room to build the occlusion now. You can leave that right in the Visiodont now and begin to do some additions of wax to the mesial and the distal to establish the proximal contact. Remember that molar teeth are square, so we have to establish a good, solid, square contact so that the rest of the occlusal surface will fall into proper relationship. You can take another instrument and just cut away a little bit of the excess that has flowed over, but when we remove this pattern, we'll be smoothing that up and cutting back any excess. Before we get too involved with the occlusal surface, let's take a moment to review some basic anatomy on this tooth. We have a little model again. Remember that lower first molars have 5 basic cusps: mesiolingual, the distal lingual, the distal, distal buccal, and mesial buccal. The central groove is not a straight groove. It tends to zigzag through the occlusal surface as it moves around these triangular ridges. Remember that the developmental grooves separate the cusps from each other and from the marginal ridges, and that the triangular ridges form supplemental grooves that point up towards the cusp tips. So with that target in mind, we can begin placement of our cusp cones onto the wax pattern. The new challenge that faces you in this exercise is the placement of these cusp cones in their correct position relative to the opposing occlusion. And to help you visualize this, you can close your Visiodont and turn it around and look here at the other side, and you can see where this unprepared tooth has its contacts in the marginal ridge areas and the central groove of the opposing tooth. That is the target areas that we will be shooting for, because the relationship is very similar on this side. So realizing this, you can see that the first cusp has to fit up inside here to touch the marginal ridge, that the second cusp touches here in the central groove area, right in the central pit, and that the distal cusp will touch up here on the marginal ridge again. So with those targets in mind, we can now begin to do our cusp cone additions just like we did on our waxing exercise. I'll do one as an example, and then we'll go off camera and finish those up as well. Build the cusp cone where you think you need it, realizing that we can always move it if it ends up in the wrong spot. And then once we have the cusp cone, close the articulator and evaluate your position. Very difficult to see here. Let's see if I can't rotate that just a little bit so we get the light in the right spot. You can see where we're getting close to having the contact. We need just a little bit more wax there. We'll bring that wax in now and try to establish that contact. And there it is. Okay. Now we'll repeat this for the other three supporting cusps, and you can also at this point realize that we have two non-supporting cusps that need to be placed, and I would recommend that you place them where they would be a mirror image of the opposing side, and we'll work towards getting them to have proper clearance when we start to move the upper and lower members in functional excursions. Okay, we've got the 5 cusp tips established. You'll notice that the pattern looks a little different now, and that's because I've dusted it with zinc stearate powder, and for photographic purposes that tends to show up things a little bit nicer. But this is also something that's very helpful for you in evaluating your progress, because the powder puts a dull surface on the wax, and then when you tap the Visidant closed into that, it'll end up giving you a little mark where you have a cusp starting to touch. You can begin to see that I've already started to establish the centric stop, and that was just by accident, but that's the kind of mark that you look for. The cusp tips still need to be built up just a little bit, but you get the basic idea. While I was doing it, I realized that I probably had made a mistake in saying that the distal cusp was going to hit on the marginal ridge, because I found it very difficult to get that distal cusp into the marginal ridge, and it'll probably end up being more on the distal pit in terms of its position of contact. But for a basic starting point, we have these cusps now established, and the thing that you want to do is move your Visidant from side to side and be sure that your non-supporting cusps are not getting touched by the lingual cusps of the opposing occlusion. So at this point, what you need to do is add a little bit of wax to your cusp tips to begin to pick up contacts. And after it starts to chill, you can add a little bit of stearate powder, zinc stearate powder. Close it in, and you can see what that looks like when I've added too much. There's a rather large mark there, and using that mark as a guide, you can remove some of the excess wax and reduce the height where the cusp was overextended. The next step is to establish the positions of the opposing cusps. And as we know, we have a spot starting to develop right there, so we'll add a little bit of warm wax to that. Dust it with a little zinc stearate powder, which, by the way, can also act as a lubricant so that the wax will not stick to the opposing tooth. You begin to see where the cusp tip is starting to form its opposing fossa right there. We also have a potential contact point on the mesial marginal ridge, which I'll work on now as well. You'll have to discuss with your instructor each individual case because there are some visitants that fit better than others with their opposing occlusion. And we do not necessarily want you to build up a marginal ridge that is very different than the adjacent marginal ridge just to establish a contact. And if you have that type of arrangement where you're not sure whether it's appropriate to build a marginal ridge or a cusp as high as it needs to be built to establish a contact point, then you can ask your instructor whether they would like you to proceed and continue to build it higher. For example, in this instance here, I have been unable to establish a contact with the opposing cusp, and the marginal ridge is already a little higher than the adjacent marginal ridge. And for the purposes of having this match correctly in the occlusion, I may want to stop right there. We're going to take a look and see how much more it would take to establish a contact. Well, that's part of the problem. It was the distal marginal ridge, it was not the mesial. So we'll take a little bit away from the mesial marginal ridge because it doesn't have to be that high. There's no opposing cusp in that area for it to contact with. And we'll add to the distal a little bit more. And we'll close down and see if we can establish a contact with that cusp. It still needs a little more wax. The zinc stearate will burn out in the oven, so you don't have to worry about incorporating zinc stearate into your pattern. It will not affect your final castings. There's the contact right there. Okay. Now, I want you to realize that what we have done now is we've established the basic functional parts of this anatomy now. We have the two centric stops for the opposing supporting cusps, and we have our three supporting cusps on this tooth established, plus cusp tips that are in good relative alignment, yet do not interfere with the function of the visitant going left and right. What we can do now is use the same techniques that we learned on our waxing exercise to begin to fill in triangular ridges and the developmental grooves, realizing that we have the opposing tooth to consider and you need to close the visitant periodically to make sure you're not overdoing it. Okay, we filled in our triangular ridge areas. I added a little bit of zinc stearate. Now we're going to tap and then go through the functional excursions that the visitant is capable of. And we'll take a look and see what we have. Now in looking at the marks, you can see that I've added a little too much wax in the central area because we're starting to get some scuff marks up on these cusps, but we can certainly reduce that. We also have a mark out here on the buccal surface that we don't want to have. But you can use these marks for reference and begin to carve these areas where we have added too much wax back. Reapply a little bit more zinc stearate and mark it again to see if we've removed enough wax. And I think you can see that we have a very nice, well-defined centric stop. We have a contact here that still needs a little bit of work. We have our cusp tip registration there and a very slight one there. This is a good time now to slip this out of the Visiodont and to do a little bit of work on the axial surfaces. You can see these areas are still quite rough here. Let's take a closer look at it. You can see the area where we flowed the wax to establish our contact, but there's a little void underneath it, and that these cusp positions have not been flowed into the axial surfaces yet. So we'll do that now by starting to establish our axial contours, remembering our heights of contour as they apply to the mesial and distal and buccal and lingual. Carefully flow wax, keeping sight of where your margin is and where the cusp tip is that you want to establish. We'll do this cusp corner here first, and then we'll go off camera and finish this up. And if you have a question about how the proximal contact is coming, if you've added too much wax to that area, you can take your Visiodont, place the tooth back, and very gently push it down into place. And while the wax is soft, you can see that the adjacent tooth will push the excess wax away. And when you remove it again, you'll have an imprint of the proximal contact in the wax, which you can then contour further. We normally wouldn't want the contact to have that much height from the occlusal to the cervical, so we've had too much wax here on the cervical. But in this area here, you can establish the correct contact relationship right there because it was formed by the adjacent tooth. Now I'm going to go ahead and do that same procedure on the other surface and finish up the axial surfaces, and we'll come back and show you that and go on to final finishing. Alright, we filled in the basic contours now, connecting from the margin areas to our cusp tips, trying to maintain the contours buccally and lingually. Notice the fact that the tooth is shaping up in a square way. We have the nice broad proximal contacts. We have the 3 buccal cusps and the 2 lingual cusps and the central groove starting to develop. Now this obviously still has to be carved out. You can hold it up from this angle, show you that as well. Still going to need a little bit of finishing. In the margin, you can see it lost a little bit of the margin right there. You can see the shine of the margin. That'll have to be refined before we invest this pattern. The other thing that you can start to do is make sure that it still lines up, that you haven't added too much wax anywhere. Go through the excursions, check the occlusal pattern with your zinc stearate. You can turn your Visiodont from various angles and look to be sure that the contours flow and match the adjacent teeth. And although it's going to be tough to do this with the camera, you can look at it from the lingual as well and make sure that the non-supporting cusps clear in the excursions and that the basic contours are appropriate from that aspect as well. Looking at it now, I can even see that way back in here, this cusp is probably extended out a little bit, and that wall's a little too straight. So I will change that at the next step now and curve that in a little bit more to get a more normal lingual contour. While we're looking at it and checking things over, we should pop the die back out of the Visiodont. You can look at the proximal contour, and you can see the scuff mark that is created when we take this in and out. Probably need to have a little bit more wax up in the contact area, but you can begin to contour these areas so that your height of contour is at your contact area. On this side, you can see the contact area is right here, and we probably have a little too much wax still down here, so that has to be carved back as well. These are all little details that you can modify as needed as you approach your final pattern here. What we're going to do now is take an instrument and begin to define some of the anatomical features on the occlusal surface, and we'll just start that. This is very similar to what you did with your waxing exercise before, and we won't do the entire surface on camera here. We'll just get started. Remember the basic anatomy of this tooth and the way the developmental grooves separate the lobes of each triangular ridge. And remember now that we have a centric stop that matches the opposing cusp tip that we need to preserve. We can't just carve that away in order to make it look a little nicer. We have to do something that's functional as well as aesthetic. So we must preserve that occlusal contact in the central pit area as we begin to define these cusps. You can see things starting to shape up now. And I think we'll go off camera now and do the final touches on this, which was going to take a little while. Alright, we've done some refinement of axial surfaces and occlusion now. We'll turn that for you and show you what we have. And that's just about ready to go now. What we need to do is do final margin refinement and get it sprued and get it invested. But before you start to remove this off of your die, it's important that we have everything prepared so that when it is sprued, you are ready to invest quickly so that it is not hanging on the sprue in the open air, distorting while you're running off to your locker or wherever, getting your materials together. So if you are at this point and you're ready to do final margin refinement and spruing, what I would recommend you do is leave it on the die and set it aside, and let's start getting things ready so that when we do have the pattern sprued, we will be ready to go.
You've been listening to a presentation from the University of Michigan School of Dentistry, which is dedicated to supporting open learning and open educational resources. This recording is licensed under the Creative Commons. It may be reused and redistributed for nonprofit use. Please attribute materials to the University of Michigan School of Dentistry and redistribute under this same license. For more information on how this and other University of Michigan School of Dentistry recordings may be used, visit www.dent.umich.edu/license.